Good afternoon. This pharmacy website was created with the intention of pulling together all the medicines resources into one location for GUH. So we'll start on the resources. So if you click here, for example, on the BNF, it brings you to a website called Medicines Complete. This is a resource paid for by the HSE and includes a lot of different sources. For example, the BNF for children, drugs in pregnancy and lactation, and many others which I'll come to shortly. If you want to search, and you want to search them all, you make sure the all publications is opposite your search bar. If you just purely want to search for the BNF, you bring that across from your search bar and work away. That will then bring you to the BNF monograph. There is also a section for drug interactions. Some of these sites are more general than others. For the general ones, I'd consider Stockly to be the most user-friendly and the most useful. So if we open that, so you can type in any amount of drugs that you want to. That many. Then you can see it actually stratifies the results, tells you how severe the reaction is, and most usefully gives you some suggestions as to how to manage the interaction. There are also some specific but brilliant resources. For example, the HIV medications interaction from Liverpool, University of Liverpool. So it includes newer drugs and it's far more detailed. So we put in that and put in you can see it. You can actually switch to a table view where it's very clear that rifampicin is do not co-administer. And you can then click on the co-administer and see more details as to what the issues are. We have a renal dose drug database. And for that we have put the username and password and click on that to bring you through to the site. I'm not going to do it now because it can be slow to load. We have the administration of drugs via feeding tubes. Again, it is via Medicines Complete. So you can scroll down till you only have that resource if that's the only one issue you want to check. And we could put in tamsulicin, and you'll see it gives you advice, says that you cannot crush it, modified release, but very usefully if you scroll down it will give you possible alternatives. Another resource that we have there is palliative care formulary. Again, going in through Medicines Complete. And we could search for hydromorphone, and the monograph comes up. A lot of detail about pharmacology, but interestingly as well, you'll see dosage equivalents for switching between opiates and syringe driver compatibilities. This Medicines Complete website is only accessible on HSE desktops or laptops. I'll move on now to the next section, which will be IV guides. The next section I'll discuss is the IV guides. We have over 250 IV guides available. They can be searched for in two ways. You can either use this main website search box, which will bring you up, for example, Tazocin anywhere in the website is mentioned, or if you specifically want an IV guide, you can search in the IV guide search box. So argatrobin, for example, you can see we'll tell you who can give it. So administration in this particular situation is restricted, and if you click on Appendix 1, it'll tell you exactly why. In this situation, it would be for critical care only. Important information, how to dilute it, how to reconstitute it, the rate and the doses. And in general, we have tabulated the doses to remove the need for complex calculations every time. The information is always presented in a standardised way, and it can include local specialist recommendations and unlicensed applications where appropriate for GUH. We've included the newest of drugs that you might find difficult to find elsewhere. So sotrovimab for COVID is just newly kept in the hospital, and it would be difficult to find that information otherwise. The next section I wanted just to show you was the GAP. So clicking on that, hopefully you already have the GAP app on your phones, and this section here on the links is really the same information as is in that app. It's a direct link to the same documents. There's also, should you wish it, vancomycin and gentamicin prescribing if you want to brush up on that. We have a micro referral form which primarily is used by pharmacists to refer complex patients to micro for review. It can be used by anyone, but please be aware it doesn't substitute for a formal consult request. There are also some other useful sections on the front page of Medinfogalway. Under local guidelines, we have the hospital's guidelines on alcohol withdrawal. We have anticoagulation and bridging guidelines that tell you how to manage patients on anticoagulation who require interruption of therapy. We created this document early in the COVID-19 crisis, whereby there was a fear we'd be short of infusion pumps, and we developed a document for determining which drugs can be given by IV push as opposed to infusion. Hyperkalemia and DKA, you can be assured you're getting to the latest document, because what you get when you click on that is actually a link to the QPulse document, so it will always be the most up-to-date one. And same for DKA. Intralipid for local anaesthetic toxicity, our local pain management guidelines, and the national guidelines for patients who are post-splenectomy. The other features that are on the front page are that you can click this button to report a medication error, and without having to go through logging into QPulse, you get directly into the medication incident report form that feeds into QPulse. You can also report an adverse drug reaction, and that goes directly to the Health Products Regulatory Authority of Ireland. And use this feedback button if you spot anything on the website that you would like to be changed, or if you know of something additional that you think would be useful to have. In this last section, I'm just going to talk a little bit about the specialist areas. Not all of these have been fully worked on. Some of them are very much a work in progress. For example, the anticoagulation one, you have patient information leaflets, you have the bridging guidelines again, thromboprophylaxis checklist, risk assessment tool for VTE and pregnancy. In cancer, if you're working in that area, you can use this section to find a protocol. Under clinical, there's prescription sheets, so you can find any of the blank prescription sheets that you need. Clinical resources, we have supportive treatment, for example, neutropenic sepsis, tumour lysis, anti-emesis. We have management of side effects and toxicity, how to dose modify for renal or hepatic impairment. Then under paediatric, through here you can get under resources, CHI Paediatric Formulary, that's the Children's Hospital of Ireland, so I'll just open it. And you can see you can search for your drug and find out dosing and administration advice for peds specifically. palliative care, again the palliative care formulary. We've also included the NCHT booklet that was written by the palliative care team, and for example Sativex treatment program and protocol. The critical care area or page is more really for the pharmacists, but some resources that you might find useful are, for example, assessing renal function, IV fluids and medications, minimum infusion volumes and Y-site compatibility, how to dose at extremes of body weight. We have a page on COVID, unsurprisingly, and subsections. For example, in thromboprophylaxis, you can find both our local national guidelines and international guidelines, how to manage COVID in pregnancy, and specialist sites for COVID drug interactions also. That's also the Liverpool University Hospital, and it allows you to put in all your drugs, the COVID specific ones. So I've been asked to work out and calculate and prescribe a dose for meropenem for a patient with renal impairment, and just to make sure that there's no interactions. So what I would do is I go into meropenem here, the IV guide, find out that it's a reserve antimicrobial. So it's a red light text. So I know it needs micro or ID pre-authorization. Firstly, once I have that, I go down, I find out my dose, usually 1 gram every 8 hours, but my patient has renal impairment, with an EGFR of 40, so I know I can give 500 to 2 gram every 12 hours, depending on the severity of the infection. So that's, say his severe infection, we'll decide to give 2 gram every 12 hours. Just check that there's no interactions. So we go on to Stockley's drug interactions. And say the patient is on valproate and aspirin and apixaban, for example. Okay, so we have a major interaction here between valproate and meropenem. The severity is major, and it says to avoid concurrent use. We can click into it for further details. A large number of case reports describe decreases in valproate concentrations. Basically, meropenem can wipe out valproate concentrations, so you would have to be very cautious in somebody who's on it for treatment of epilepsy. So you can see with just a few clicks you can get all the information that you need about prescribing, the restrictions, the doses, renal impairment and interactions. So for this example, I'll show you what happens if, for example, I was asked to prescribe intravenous immunoglobulin for a patient for ITP, a patient who weighs 145 kilos. So first, and I've told to use the Kyovig brand. So first off, I complete an inpatient authorization form, which I can get here. Click on that and it brings you to this form, print and fill out. Then you go and you find your dose. So for ITP, say for example 1 gram on day 1, repeated once within 3 days. So the patient's 145 kilos, but because he's a BMI of 30 kilograms per meter squared or more, we have to recalculate it. So he's male, say he's 175 centimeters, 145 kilos. His ideal body weight is 70 and the dosing weight is 100 kilos. So we want to give him 1 gram per kilo, so that the dose then is 100 grams as a stat. So it's a dose in between his ideal body weight and his actual body weight of 145. The reason being, it's a blood product. It's in worldwide generally short supply. it doesn't distribute into adipose tissue, and the neurologists and haematologists have agreed that for patients who are of a high BMI that we can use this adjusted weight.